Then you can start using the money, the resources you have for infrastructure, etc., and then leading to industrial growth, as Mrs. Mvundula had been mentioning. Next slide, please. If you can click again. Yeah, I think we've seen this again. The population is growing. So we talked about Gen Z. We should also talk about the baby boomers. Some of us were there at a time when the population was under 6 million, 4 million and all that. We were there and we were growing up in the streets of Blantyre. We know what it feels like to have very small population. When a car goes, you spend 10-20 minutes before another car goes, etc. Things worked because you had a relatively small population. But as the population increases, we can't have the same infrastructure. We can't have the same Queens. We can't have the same Lilongwe, central hospital. You have to invest more and more to take advantage, to actually provide for the growing economy. We can't have the same schools, the same teachers as the population is growing. So those are the challenges we need to grapple with. If you can click again, it's the same slide, but okay. So it's not all doom and bad, because our fertility has dropped. Because at the time when we were around 4 million, 3 million in the 60s, fertility on average was 7. A woman was having 7 children during their lifetime. That's quite a lot, a large number of children. But fertility has declined to around, in the 2018 census was about 4.2. Now World Bank predicts it's about 3.85. Still relatively high, but showing a decline. If we can click again, yeah. So the challenges we have is that fertility is actually highest amongst those who are actually poorest, yeah? So it's those who are actually unable to take care of the large numbers tend to have many children. So when you compare those with no education, the average is about 5. And then you look at the women with tertiary education, average is about 1.6. So roughly about 2 children per woman. Okay. And then I already mentioned the population growth, but the issue is that if you have such a large percentage of growth, every 28, 30 years your population doubles. So you think about the number you have now, in about, say, 23 years' time, you'll have double the number that you have if everything stays the same. So if you're thinking, okay, my space is crowded, it will be even more crowded. Okay, and Dr. Zulu already mentioned the issue of population momentum. And I think this is where people get demographers wrong, because demographers don't say, we're not saying don't have children, but we're saying have only the number of children that you want to have. You take advantage of, contraception and all that. And those people who don't want to have more children, let them access services. But if you have only the number of children that you think, okay, I can take care of 2, I can take care of 3, that's fine. It will slow down the population growth, and that's important. But because of population momentum, we'll still reach the 40 million of people in Malawi, because people are already here. Even if they all have just 2 children per couple, we'll still reach that, because we have a large number of the parents already in existence. Next slide, please. Okay, so the map I have there is just showing the differences in fertility rates between the districts. So the red color means 5 or more. So in those spaces, it's not just that the people actually want to have many children. Many of them have problems accessing contraceptive services, and we need to make sure that they can access the services so they can decide the actual number of children that they want to have. But as you can see in the cities, you have compared to the red areas a relatively lower fertility. So access to contraception is very important. Next slide, please. Okay, so as I said, the challenges with a very rapid population growth is that essentially the state fails to provide for services. The country fails to provide for services. And I have the bar charts there just trying to show data from the Integrated Household Surveys done by the National Statistical Office, just showing the percentages with inadequate food. Those are the ones in blue-green. Inadequate housing, those are the ones in yellow. And inadequate healthcare, those are the ones in purple. So over time, from 2010, 11, then to 2016, you see the numbers increase, and they keep increasing. With the same level of economic growth, the same resources that we have, as the population increases, our per capita, or the government's per capita spend on you diminishes, gets lower and lower and lower. So it's not surprising that you go to hospitals, there aren't the drugs that are needed, you don't have the bed spaces, you don't have the classrooms, you don't have the desks, because our population is growing much, much faster than our economy. Next slide. I mentioned about the opportunity from youth demographics, and this is an opportunity for Africa as a whole. And what we have there are just graphs just showing that in all the regions of the world, population has sort of peaked, and when you're looking at youth demographics, it's only the continent of Africa where you will have youth populations growing to 2100. So that's the only region that will have an influx of young people to take on jobs, etc. In the rest of the world, many of the countries have very low fertility, too low to sustain the population, so their populations are shrinking. And with that, that means that they have to either use technology in a big and meaningful way, because you don't have essentially the numbers to go into the factories, etc. But we know that there are certain things that technology, AI can't do. You still need human interaction. Even the elderly need human interaction, somebody to chat with them, to give them tea. Those are the jobs that will be in demand, because there are fewer and fewer young people in Europe, in most of Asia, and to some extent in Latin America, etc. Next slide. Okay, so the challenge is that we need to invest more in education, in technological skills, and we need to also invest more in health to ensure that we can reap the youth demographics benefit. Next slide. Okay. Unfortunately, we have a poor base in terms of education. So when you think about the levels of education of people in Malawi, on average, the mean years of schooling for females in Malawi is 4.1 years, and for males is 5.1. That's just every population. This is not looking at school-going population, but the whole population. When you look at the average years of schooling for men, for women, 4.1 female, 5.1 males. Compare with Botswana, 9.2 males, females, and then 9.5 for males. Zambia, slightly better than Malawi, 6.7 females, and then 7.1 for males. In part, we have a challenge of early marriages. Our girls getting married quite early. So looking at our adolescent population, those 15 to 19, almost 20% are already married. And then those who are 20 to 24, by then we're thinking they should be graduating from tertiary colleges, from universities, they are already married, some of them with even 2 children, etc. And then we contrast, for example, in Botswana, only 4% of the 15 to 19 are married. And then only about 30%, 20 to 24 are married. So by delaying marriage, we actually provide opportunities for boys and girls to remain in either training or in college, in secondary school, so that they can actually upskill and become, more productive, economically productive members of society. Move on, next slide. And then we've heard a lot already about the digital literacy. And we, as a population, yes, our internet usage has increased from something like 9% in the, say, was it around 2002 to about 24%, but that's still quite low compared to other countries. For sub-Saharan Africa, as an average, it's about 38%. I compare Mauritius, about 88%, Botswana, about 74%. So massive increase for African countries, but we are still lagging behind. And I think from the conversations in the morning, it was clear that by digital literacy, we're not just talking about being able to use WhatsApp, being able to do YouTube and all that, because everybody is doing that. But it's actually the skills that are needed to do something like what Rachel did, to actually create a deep fake and to provide a service like that, sometimes for good. But some of the deep fakes, as she said, are not necessarily for good. They're usually for nefarious purposes. Move on, next slide. The other issue is that we have a large number of young people who are essentially not, in dignified and fulfilling jobs. So only 8% of Malawi youth have regular employment with a contract of 1 year or more. Most of them are in vulnerable employment. Yeah, we're looking at 58%. Some of them are in tertiary education, etc. So when we do surveys and say, are you working, or do you earn an income, and the answer is yes, we need to actually delve deeper. Going to sell T-shirts by the roadside where you get just enough for one day is not a dignified, fulfilling job. Yeah? There is no security there in the job, because if you are ill today, that means you don't eat. So our statistics, we need to scrutinize them carefully. The consequences of our young people not able to work, not able to get jobs, is most of them tend to emigrate using unsafe routes, going to South Africa or going across Africa, so they can end up in Europe and places like that, and sometimes end up dying as a result of the precariousness of their trips. But then you also have the vulnerability, and then they are exploited, and we've seen a lot of that with during the political campaign seasons, where young people tend to be exploited. Why? Because they don't really have anything, to do, especially in terms of earning an income, etc. Next slide, please. Okay, so I mentioned the low fertility, and the opportunity here is with a shrinking population in other parts of the world, okay, Europe, Asia. That means that there will be demand for highly skilled labor force. So the countries who are actually investing in young people so they can speak the language, or English, or whichever language, very well, who can actually have the skill set to, work computers, to do some programming, they're the ones going to be at an advantage. So I once had an opportunity to do some work in Mauritius, and Mauritius, previously they were reliant on sugar and tourism. And when, the sugar, market started wavering, and with tourism, you only had to see what happened with COVID to see that this collapsed. they actually decided we're going to invest in our young people, especially in IT skills, etc. So now these young people work for the largest banks in the world. They don't have to move from Mauritius. The government has set up all these big high-rise buildings. Majority of their young people are there, very well trained, but they are working for banks virtually, remotely, and able to bring in, income, not just for themselves, but also taxes to the government. But the other thing they did was also telemedicine. And as we move on with technology, we won't need necessarily to go and see a doctor physically. The algorithms will do that. You explain the challenges, and you get to know what is wrong with you or what treatment it is. Behind that is AI, the skills of young people who are able to do these things to make life easier, to make people live healthier. The other thing you have seen, and we've seen that with examples. Israel is not a very good example because one of the reasons for the taking young people is to do with the war. But increasingly, we are seeing countries in Europe making deals with governments to bring in their young people who are technologically savvy, educated, etc., to go and work in their industries. So, that may be an opportunity, but it has to be something that is protective of the young people. That's why I've said in the regular labor migration routes, so that our young people are not exploited. Okay, and next slide. I'm nearly the end. In terms of what we must do, I actually came across the Commonwealth Youth Development Index, which I thought is a nice framework for what it is that you need to do with young people to develop them. So the framework has education, which I've just said, employment. We also have the health and well-being, equality and inclusion, making sure that everybody has the same opportunity or has opportunities, not just a few people. Then there's the peace and security, really important. And then political and civic participation are important. And together, you have these, you get Youth Development Index. Malawi's Youth Development Index is classified as low at 0.628. And in Maine, it's brought down because of low quality of education. So you compare, Ghana, 0.721, because of relatively high education, Mauritius as well. So we need to try and invest in our young people so that essentially they can be the engines for transformation for the country. Okay. Just the next slide. I like to show numbers because numbers just bring you down to reality. So the charts are just showing the numbers of young people in need of primary education, that's in blue, and then in need of secondary and tertiary education, that's in orange, over time. And the numbers are in millions. So we are looking at increasing every year the numbers of school places, the numbers of secondary school places, tertiary, just because our population is growing. Otherwise, we are in big trouble. Okay. And I think I won't go through the next slide, which is about the consequences of inaction. I think Dr. Zulu mentioned that, but I've also mentioned that we have the immigration, we have violence in the cities, but you also have youth exploitation because young people are then used, given small amounts of money and then are used maybe for bad things. Next slide. So, to summarize, our youth, they form a large percentage of the population, but the challenge is they have low levels of youth development, mainly because of low quality education, not enough skills, and essentially no real prospects for meaningful participation in society, either as workers or in political and civic participation. We can change that around if we invest in health, we invest in education, we invest in high-level skills, especially digital literacy, to make our young people globally competitive. Okay? And then the final thing I said is that we can take advantage of the low fertility of countries in other parts of the world, because they are going to need workers to work in their factories, to work in their banks, to work in their hospitals, and our trained young people can take on those roles. I want to thank you for your attention.
Thank you so very much, Professor Nyovani. She did mention that I like to show numbers. Do you know why? Her work focuses on generating evidence to accelerate the achievement of SDGs, and she holds a PhD in social statistics. She also has an honorary doctor of science from the University of Aberdeen and a BSc in mathematics and economics. Spent 25 years at the University of Southampton as professor of demography and social statistics. I guess it spoke to what she was talking about. Another round of applause to Professor Nyovani Madise. I guess we are very lucky that we've got the brains that have it all in terms of evidence that we can use as a country to grow from where we are to the next levels. Just as we did before we went for lunch, there will be a panel discussion, and this panel discussion is going to be moderated by Mr. Clarence Gama. He's the CEO of Nico Technologies. He will introduce his panel as he comes up front. Where are you, Mr. Gama? Oh, thank you so much. So as he comes up front, I wanted to say that Clarence has been leading teams in financial and telecommunications and technology teams for over 18 years. He is the president of ICT Association of Malawi and CEO of Nico Technologies Limited, and successfully managed IT services and digital transformation company in Malawi. He's an information technology graduate from the University of Malawi and IBM certified in leadership, cybersecurity, and project management. He has also served as chairman of the Digital Grants Committee for the World Bank funded Digital Malawi project. Ladies and gentlemen, Clarence.
Thank you very much, MC. Yeah, whoever wrote that must have studied me very, very well. Ladies and gentlemen, good afternoon and welcome. Health and wealth, innovation and technology for inclusive growth. See, the fact of the matter is that there's an intersection between health and wealth in Malawi. And this part is very crucial to our national development, as we've heard from Prof. Madisi. Now, innovation and technology have the potential to drive this inclusive growth we're talking about, ensuring that there are advancements that will benefit the entire society. As a Malawi, we've been talking about leaving no one behind, and therefore everybody must be included. Now, we've heard about healthcare. We need solutions that can improve healthcare. We need solutions that can advance technology and also food security, among others. You see, technology is becoming very powerful, and we need to leverage on it. This is why this afternoon we will explore the innovations that can be harnessed to create a more inclusive and prosperous Malawi. Now, ladies and gentlemen, joining me here on the panel are 4 individuals in various expertise that will help us dissect this conversation further. Let me start by inviting to the podium Dr. Kingdom Kwapata. Dr. Kwapata is a senior lecturer in molecular genetics and biotechnology at the Lilongwe University of Agriculture and Natural Resources. A hand for Dr. Kwapata. Joining us again, in addition to Dr. Kwapata, is Professor Adamson S. Mola. Professor Mola is a professor and head of community and environmental health at the Kamuzu University of Science and at the Community of Health and Sciences. A hand for Professor Adamson Muula. Joining us again is Mrs. Alinafe Kalombo Mitiani, who is a head of information technology operations at the World Food Programme. Can we please give her a hand? And finally, ladies and gentlemen, but not the least, is Mr. Kondwani Gondwe, who is the director of planning at the National Commission for Science and Technology, NCST. Can we please give a hand to Mr. Kondwani Gondwe? Ladies and gentlemen, you're welcome. This is a very pertinent conversation that we have been entrusted with. At the end of this session, we should have given the right insights based on our expertise, but also we should feel free to ask the critical questions that are required to get the right responses. At some point, I will give the audience a chance to also contribute into your insights. Please keep your responses brief, but straight to the point. Don't leave out the critical aspect of it. Also, let's make sure that when we are giving examples, the examples should be relatable, and also they should be within the relevance of this conversation. Let me start by asking you to just briefly say more than what I've already said about you, and then I'll kick off the conversation. Mrs. Kalombo Mitiani, let's start with you. Just a brief introduction.
Thank you, Mr. Gama. As the moderator mentioned, I work with World Food Programme as the head of IT technology. I think we are moving towards moving from head of ICT to head of technology, but I'm also playing quite a critical role with MACRA and DODMA in trying to establish some frameworks in the area of emergency telecommunications cluster in Malawi, and there's a lot of work that we are doing together. Other than that, I think let me stop here. I'm so happy to be part of academics because I'm a PhD student. So seeing the doctors, it's really exciting and motivating.
Thank you very much, Mr. Gama. As you have rightly said, my name is Kingdom Kwapata, and I am a senior lecturer in molecular genetics at the University of Agriculture and Natural Resources. My work is mainly on the DNA technology, and I work closely with the Malawi police trying to establish a forensic framework for the nation so that we can be able to use DNA technology in fighting crime and other types of issues related to national security. Apart from that, I also work in different areas of genetics, such as personalized medicine, using bioinformatics and other tools in genetics in order to ensure that what we are prescribing to people or patients is tailored to their genetic makeup. In brief, let me stop there.
Good afternoon. I'm Adamson Muula from Kamuzu University of Health Sciences. Very difficult to introduce myself because it's a difficult task, but maybe to remind my colleagues, the generals that I interviewed for the army 35 years ago. So that's part of me. 35 years ago, I interviewed for the army because at the time there was plans to build a military hospital in 1991-92. That's when I interviewed, and they said, when we've got the results, we'll come back to you. So I'm waiting to get the feedback. I am in public health, but related to medicine. Thank you.
Thank you, Clarice. As you introduced me, my name is Kondwani Victor Gondwe. I'm the Director of Planning and Resource Mobilization in the National Commission for Science and Technology. Part of my work, I sit in as a focal point for the African Science, Technology and Innovation Indicators, an initiative which is supported by African Union Development Agency, NEPAD. But I'm also a focal point for the implementation of the African Union EU Innovation Agenda, which has just been endorsed by the ministers last week, which is also focusing on the work that we're doing today, that will focus also on the issues of infrastructure development, but also areas to do with capacity building. Apart from that, I also sit in the desk, which is actually responsible for establishing the Malawi Academy of Sciences, which Professor Mula is one of the directors. Thank you.
Thank you very much. That's very interesting that we're bringing together like-minded individuals here to share these critical insights. Now, Prof, I'll start with you, and riding on the previous presentation by Prof. Madisi, the public health sector is very clear it needs technology. And we already know that the technology, at some point, there is already some aspects that are there. We've heard of telemedicine, but perhaps not fully integrated in the system. My question to you is, from the public health sector perspective, are you seeing a chance where technology can be leveraged to improve community health outcomes in Malawi? Is that something that we should look at, that the well-being of the community in Malawi can be influenced by technology through the health sector?
So thank you very much. I'll give a few examples. At the height of the COVID pandemic, for instance, using simple technology as Zoom, there was a time when the Committee on Health within the Ministry of Health could meet every morning and evening to make decisions for the presidential or to make proposals. But just using Zoom, we could meet morning, evening, over a period of 2 weeks. And that sort of contributed to the health of our people, because otherwise all of us were all over the country, somewhat in a lockdown, although there was no official lockdown, but we were able to meet, even using that meeting. This morning, I received laboratory results for a patient from Blantyre. Now I'm able to look at the laboratory results and make decisions. Do I call them, we meet tomorrow, do I advise you go to the hospital, and so on. So even using simple technology like that, you find that health is promoted. I'll say another example in diagnosis, because our eyes may not be that perfect. So using AI and specific gadgets, one can look into a person's eye and have some suggestions of diagnosis of illnesses. So that is being used. I'm saying some suggestions because in the end people question, if you're using AI and AI has told you about a disease, who is responsible for that? Is it you as a doctor or the machine? And if something went wrong, who would be liable? So there's a lot of opportunities and things that are being done now in the harnessing of technology.
No, thank you very much. All I know is that lab results tend to come faster now in the hospitals. Therefore, there is definitely some element. But I just want you to confirm that the examples you're giving is what is now in Malawi, and not just what is out there, but here in Malawi.
Yes. Those are happening here. The first example was in terms of various sort of experts meeting and coming up with decisions and so on, using simple Zoom or other meeting platforms. The issue about me getting the results from Blantyre this morning is also something that is happening, and the diagnosis to look at, because if you want to look at the retina, for instance, within the eye, previously you would take a torch and a magnifying glass and look into somebody's eye, of course after dilating the pupil. Quite not efficient way, but now you can shine a light into somebody else and you see right behind it using these technologies. It's possible, and it is in Malawi.
No, thank you very much, Prof. You see, I wanted to highlight that point because before we start talking about what else we could do, we need to take cognizance of what is today and how we can ride on it. Mrs. Kalombo Midian, let me come to you. And WFP is a humanitarian, it's part of the humanitarian sector. Now, how has technology been used to enhance food security and support vulnerable populations in Malawi? There are quite a lot of vulnerable populations, and reaching out can be an issue. Is technology playing any role in that space?
Thank you. I would say yes. In humanitarian sector and UN, the technology is quite broad, but to your point, when we come back home, I'll give 3 examples where I find that technology has actually played a great role. The first one being the famous unmanned aerial vehicles, which is also known as drones, remote sensing, as well as a bit of AI. So a good example is during Tropical Cyclone Freddy, a team of drone experts comprising of several stakeholders led by WFP, they actually went to hard-to-reach areas to assess the damages that had happened, including crop damages. And there were points like in Nsanje where some drones were used to deliver small packets of food to people who were stuck in small islands, and also even delivering some few critical medicine in that aspect. And I must say, like, for example, in the disaster that happened in Nkota, some images were fed into an application, an AI, and this application was able to actually determine which houses had no roof, which houses had roof, and that assisted the humanitarian sector to respond accordingly and to even also respond faster. The second example I would give is around the digital agricultural platforms. It's still booming, but at the moment there are some applications that our farmers actually can tap into, and also even the SMS as well that are being sent into to their mobile phones on weather forecast, on the best farming practices and the market price as well. So this type of information is helping our, especially smallholder farmers, and for our interventions, especially in the southern region, to be able to make informed decisions. And we have seen that it's actually contributing to a bit more improved crop yield, as well as reducing post-harvest losses. And talking about post-harvest losses, although the technology may look small, but the third example is around the bags that we're actually distributing to some farmers in the southern region, the Purdue Improved Crop Storage, some people call it PICS. These bags, we have seen that they have actually reduced post-harvest losses because the farmers that are using these bags, the grain is actually kept well for almost even a year. And that has also led to some households even experiencing improved food availability. Let me stop there. Thank you.
The PICS example is an interesting one. I don't know how many of us have benefited from the PICS bags, where you are really protecting your crop in that space. Maybe I like what you said. Say the technology may look small, but it is a technology. It is a technology, and I think a very useful one. Let me come to you, Dr. Kwapata. And again, molecular genetics and biotechnology. That is really quite interesting. I mean, it also sounds complex, I should say, coming from me as a layman. But I would be interested to know what are some of the most promising innovations that you think could impact health and wealth in Malawi? Are there any in this particular space? And I'm sure it's not just me who's who's new to molecular genetics and biotechnology. So if you could think of any, you could enlighten us. Thank you.
No, thanks very much. I think the first thing that I want to say is that we cannot divorce the intersection between health and wealth. You know, when we have a budget that maybe over 30% of our national budget goes to health and health initiatives, it means it's a significant component that can significantly affect our economy. So if we have a deteriorating health population as a nation, obviously that becomes an economic burden to the country, and as such, we cannot move forward. We would invest so much in the procurement of medicine and other things of that nature, and that can be a major challenge. Now, coming to your question, my focus, and one of the major problems that we have in the health sector is misdiagnosis of diseases, where you go to the hospital and the medical practitioner misdiagnose what problem you are having, and in so doing, what happens is that the patient continuously goes to that hospital or changes hospitals, because the drugs that he or she is being given are not working, and it is simply because the ailment is misdiagnosed. So that becomes a critical challenge. And again, that becomes also a burden in terms of economics on that front. Now, my area of focus is precision medicine. What that means is basically we have understood that, for example, I'll give you an example of ARVs, that not one size fits all. You go and you give such medicine to different individuals, they will respond differently. They will react differently, side effects and all those things. Now, more complex diseases such as cancer, that's also the situation. So my area of expertise would now to look at specifically in the gene, what are the what we call markers that will enable an individual to respond to a specific drug or not. So this personalized medicine is basically looking at the whole genetic makeup of an individual, because the people to respond, or individuals to respond to different medicine, it also has to do with their genetics. So if those individuals that are not responding to a specific type of medicine, we have to prescribe an alternative based on their genetic makeup. So this is a new area that people are now trying to look into, so that when you go to a hospital, before, more especially for the complex diseases, like I said, cancer, or even AIDS and other things of that nature, before the doctor or the clinician prescribes to you the particular drug, he or she has to refer to your genetic makeup and be able to know that, okay, this particular genetic makeup is not compatible with this particular drug, but rather this particular drug. So that increases efficiency in terms of now providing the right medication to the individuals. And with that improved efficiency, that entails that you reduce cost, and that is also good for the economy as a whole, because in the country, as Malawi, we don't have to, when we import drugs, I've read in certain paper that maybe apart from expiring, but because of misdiagnosis, over 45% of those drugs are misallocated. So if we are able to properly diagnose and give the individual what he or she needs, then we can be able to make these savings.
Doc, that sounds very detailed and also sophisticated. What I'm wondering is if biotechnology works that way, is there a way it can be applied in agriculture? Is there a way where you could say same concepts but now maybe detecting crop diseases and being proactive in that space? Is that a possibility?
Oh yeah, there's a lot of activities happening in agriculture, and I think it will open a Pandora box. That's why I didn't go in that direction.
Okay.
I focused on the health aspect, but when we talk about agriculture, it's a lot of things that are happening.
Okay. No, it's amazing to learn the impact of biotechnology overall, but Malawi being a highly agriculture-driven nation, I think that would be worth looking into to leverage on that. Mr. Gondwe, welcome. And as Director of Planning at NCST, innovation is at the heart of NCST, I'm aware, having worked with you in the past. But what are the key priorities that, for fostering innovation and technology advancement in Malawi from your office?
Thank you, Clarence. Thank you for having us from the Commission. I come here representing the Director General, who should have been here, but she is committed to other government assignments. So I think for the benefit of members, first of all, I should state that the Commission is there to advise the government and other stakeholders on all science and technology matters, basically to achieve a science and technology-led development. And therefore, we were operationalized in 2010 by the Act of Parliament, and the Commission works as a science granting council. So we finance research and innovation. We also regulate research. We clear research protocols, even what you call the trials, for example. You talked about the biotechnology, which is from agriculture, which is another big issue. We are actually working hand in hand with the Department of Environmental Affairs to ensure that biotechnology in agriculture is adopted in the country as well. But above that, we are also a coordinator as an organization of research and innovation in the Malawi STI ecosystem. So coming to your question about the priorities, I'll focus on the Science, Technology and Innovation Policy 2024, which is almost possibly 70% done. The government is planning to roll out that policy by February 2024. So we are still in the consultative stages where we are getting more inputs from the stakeholders. But the key priority areas that speak to science, technology, and innovation as a bunch, not separating each from the other, is that we want to focus on governance and coordination of innovation. We also want to promote the application and integration of science, technology, and innovation into the key growth sectors for sustainable national development. We also want to promote enhancement of industrialization through science, technology, and innovation. You may be aware of the African industrialization strategy, which was actually adopted by SADC. We have already mapped the key priorities within the industrialization strategy for Malawi, as well as other African countries, which will lead us to identify those potential areas where we can actually advance our industrialization. Market access is also another problem for STI products. This will actually promote what you call import substitution and through exports. The reason is that you take note that Malawians don't like buying products made in Malawi. They would still prefer, products that are made or innovations that are made abroad. So that priority will also focus on how we can bring in the aspect of what you call prioritizing or maybe demanding what is made in Malawi. The development of STI infrastructure is another priority area, and then the human capital development, which speaks to what Professor Nyovani Madise and also Dr. Zulu in the morning about the youth. So the human capital development is meant to support STEM education, and in that scope, we want also to focus on how the youth can be more innovative to spur the economic development. And then financing of science, technology, and innovation to support the innovators that we have in the country. And then the best practices for STI. These are the 8 priority areas which the 2024, the draft STI policy in Malawi is looking at. But just to add on the priority areas, we have also the grand challenges. Maybe before the grand challenges, I may need to talk about the national research agenda.
No, but maybe before you go there,
Yes.
I think the priority areas are clear. And I've picked 2 things. The STI policy is still at 70%, you know, which makes me wonder if, are we ready to forge ahead at this point, or we need to get to 100%? Secondly, the financing of science, technology, and innovation initiatives. I'm aware that you have a fund. Is that still available, that fund?
Yes.
And are we able to point to say we are now making a change in this space worth this much money?
Yes, so I may want to start with the policy.
Mm-hmm.
The policy was a directive by HE,
Yes.
His Excellency, the State President, Dr. Lazarus McCarthy Chakwera, during the launch of Unipod. He actually made a declaration, or a decree rather, to say that the science and technology policy for Malawi should be revised before December 2024. But then certain things haven't happened according to the plan. So the ministry has actually extended that duration to February 2025. That's why I was mentioning that it's 70% done, because it has to go through certain stages.
Mm-hmm.
But coming to the question on the S&T fund. So the S&T fund, yes, it is still active. One of the strategies which we have put across for Malawi to benefit, or Malawians to benefit from the fund, is to scale up that fund.
Mm-hmm.
Because government alone was not able to put adequate resources into the fund. So for example, in 2023 financial year, the government had put in 450 million kwacha. All right? So that's not enough money for us to support, you know, STI developments in Malawi. So we came up with the Grand Challenges Malawi initiative, which is an initiative that was promoted by the Bill and Melinda Gates Foundation in collaboration with the African Union Development Agency. So in Africa, you have got Grand Challenges initiatives in 5 countries. There is South Africa, there is Rwanda, there is Nigeria, and there is also Senegal, as well as Botswana. So Malawi and Rwanda were initiated last year, 2023. So the initiative promotes what you call matched funding. Mm-hmm. So if the government of Malawi puts in resources, then you have the philanthropy funders that also bring in money. So one of the priorities there is our issues of health and climate change nexus, and also we have health and well-being, energy generation, and agriculture productivity, 4 priority areas. So these are basically emanating from the Malawi Implementation Plan 1. They were not created as separate priorities, but they were extracted from what we already have as national priorities.
I think the takeaway that I wanted to drive home is that one of the best, one of the most important roles of the NCST, which is to fund these STIs, we can't be running out of money in that pocket. And I think as a nation, we need to work together to be feeling more. I mean, I'm also privy to be part of the ICT Association of Malawi, and we receive a lot of brilliant innovations. And you don't know where to send, these youngsters. And these are the innovations that will later transform food security. It will transform, the health sector, and also education going forward. Madam Kalombo Mitiani, let me come back to you because you spoke about drones and the impact that they made at some point in your earlier presentation. Now, food security is a critical matter. And in fact, I don't know if you, my colleagues, have heard of, and I'm sure we have all heard about other areas in Malawi where people are living on cooked mangoes. I even heard of stories where people are living on, on chiteze as food. And I'm saying food crisis in Malawi is a serious matter. And is there a way?
Which is accessible on the internet. It's called the Global Hunger Monitoring System, which is a kind of a hunger map, and it uses predictive analysis to actually predict that this country and in this region there would be a food crisis. But what I've noted is that if you click Malawi, you would not find a lot of data, and most probably because in also other areas that I've interacted with, I think like SADC, they've got also a portal, but even when you click Malawi, you also find, you'd also see that there isn't enough data. So maybe the question that we as an audience, as we progress through the 2 days and further, is to say how do we bring to get data in one place, and how do we enable accessibility that that data can be tapped into and provide a better view than other countries in Africa. So this system it actually helps, but I think taking a step further is that now, because the humanitarian can only do much, but I think it's now when we have such type of data, what else can we do with it? Because obviously the hunger now it's really serious, the crisis, but what can we do also as collaborating together to add on to what the humanitarian sector is doing. But yes, data can be leveraged, and technology as mentioned with the hunger map.
Yeah, because we need to find some kind of balance in terms of how we can predict. My wife says, every time you see a lot of mangoes, there's going to be hunger. Or every time you see a lot of sweet potatoes, there's going to be hunger. But I'm thinking that's not data we can rely on. I mean, the truth of the matter is you would have seen that the times when the nation is really struggling, there's a surplus in these areas. But I think with the help of data experts, we really should be able to predictive analytics, I think as we call it. I see Mr. Karim from FTH Bank there. He's one of the experts of predictive analytics. I think we need that kind of foresight where we could say, look, we need to prepare because perhaps we may have this this crisis. Dr. Kwapata, let me come back to you again on precision medicine, and listening to you, as I said, biotechnology is a game changer. Not looks like, but in my view, from listening to you, is definitely a game changer. But are there any challenges that you face as you integrate biotechnology into the Malawi's specific health sector overall? And I'm bringing this question because from an ICT perspective, there seems to be a lot of ICT related, there seems to be a lot of hurdles that come as a result of perhaps, I don't know, unstable ICT. But my question is to you, what challenges do you face integrating such a complex technology into our health sector overall?
Yeah, no doubt it's a very expensive undertaking, and the infrastructure required for it is heavy. I think we need to invest as a country, but I think we can only invest if those people with the resources, Ministry of Health, the Ministry of Finance, maybe appreciate the importance of having this technology at their disposal. I'll give you an example. I think there's a project running right now in the Ministry of Health under FRIM. It's called genomic surveillance. So what happens is that you want to predict the likelihood of a disease occurring in a specific region. In this case, I think we were looking at cholera. So you go into specific areas and then you collect samples, and then those samples you analyze them for the specific pathogen that you think might be in that particular area or that you are actually looking for. And if it reaches a specific threshold, you can predict that in this area there will be a cholera outbreak. And then you can do early interventions before such an outbreak comes out. And such interventions will ultimately save costs. Rather than you wait for such an outbreak to come out and then you start firefighting, it doesn't work that way. So at least we have started something, and I'm very happy that that project was launched, and we are working on it to ensure that you know, such surveillance data can be provided to the decision makers in time. But obviously, I think there may also be challenges in terms of collecting such data and making presentation, analysis, and so on and so forth. So if we can do this on a wider scale for different types of diseases or pathogens, I think we can make headway. So that's one example that I'm giving you of a practical project that is currently being executed by FRIM.
Any challenges along implementation of that project?
Yes, that's what I'm saying, that, you know, collection of that data now, because you need to have people collecting in the different locations and then sending samples and then the analysis. So it's an expensive undertaking initially, but the follow-up or the outcome is much, it becomes much cheaper for the nation. For example, if we're able to predict an outbreak of cholera in a certain location in advance, then we can take precautionary measures to ensure that you know, our hospitals are not flooded with patients, and we are, you know, continuously transmitting that disease throughout that particular location. So we need to invest more, obviously, we can do better, and I think there are many more of specific pathogens that we could look into, that we could target for early warnings in our health setup.
Oh, thank you very much. Thank you very much. Now, I'm going to open up the audience shortly, but Prof. Mola, you know, listening to you earlier, you somewhat sound, no, maybe not fully satisfied, but you're so far happy with technology in the health sector. That's what I got from you, to say, look, we are able to do things better now than we used to do before. But my question to you is, you know, implementing these technologies, especially these health-related technologies in the rural and underdeveloped sectors, what challenges are there? Is it that easy for you to just move a technology from, you know, from Queens and then you take it somewhere to the rural areas especially?
So thank you very much. The issue about whether I was satisfied is more to do with attitude. Because if we looked at the problems that our country is going through, like many countries, and we want to inventorize, there will be many.
True.
But coming from